guys, this is Brittany. I am coming to you today, 10 days post-op. I know yesterday I said it was 10 days, but I kind of cheated on my food, so I kind of skipped a day. So yeah, that's why I said yesterday was day 10, but today is actually day 10. Please forgive the fact that every time I come on here, my hair is just gross, and I'm just like, ugh. I just don't feel that great. I mean, today and yesterday I feel like 10 times better than I did, like, last week. But I still don't feel wonderful. I still have a really hard time with, like, just kind of being tired. But everybody says that that's pretty normal because you just had, like, major surgery and everything. So basically, I wanted to just talk a little bit more about what happened during surgery. I went in the morning. My surgery was scheduled for, they didn't give me a time. I had to be there at 7:30. They were like, whenever we take you back. So I had to be there for 7:30. My brother had to be there for 8:30 because he was having the VSG on the same day, which was good and bad. So I got there, I waited in the lobby, then they took me to the back. They took me to, like, the pre-op area. I got my clothes off, I used the bathroom, they worked on an IV, they asked me a million questions. I had a number one question that was, like, I didn't want a catheter at all. And I asked the anesthesiologist when he came by, and I was like, just so you know, if you give me one, like, if you're thinking of giving me one, I'm leaving right now. Like, it's not happening. I was like, I talked to my doctor. My doctor said I would have no tubes sticking out of me other than an IV when I woke up. And of course, the anesthesiologist and the nurse and all that, they were, like, laughing about it. And I was like, no, you guys don't understand. I'm serious about this. And he said they don't give any for sleeves because sleeves are really, like, you know, it's like a really short surgery. So they really don't do it for those. Sorry, I'm distracted. Anyways, so that happened, and then I was waiting back there, and then they let my husband come back, which was great because I started to get teary-eyed because I'm, like, freaking out. I mean, this is something that I'm doing for myself. It's not something that, like, I'm not doing this, like, because I have to. Like, when I had my tumor removed, I wasn't as scared because it was like, okay, well, this is just something that has to be done. This is more like, this is my decision. This is what I chose to do. So I went and, you know, my husband was back there. He was so great. He's been really sweet to me ever since I decided this and all after and everything. But anyways, yeah, so then my brother comes to the back, and they're trying to get an IV on my brother, and he's, like, even a harder stick than I am, and, eventually they get him, and, you know, everything's great. My mom comes to the back to sit with him, so it's, like, it's really cool, because I get to have both of them. They actually let my dad come to the back, too, because my mom and my dad kind of threw a fit. They were like, you know, if you take my children back to surgery without me seeing them, and of course they were like, oh, they're of age. My mom's like, fuck you guys, okay. Okay, she didn't say that. It was my dad probably said that, but, anyways, they let them back there, so I had all of them back with me, and then it was like, when they called my name, then when they said, you know, Vicnair to surgery, I was like, I started to breathe really hard, and I was like, oh no, what am I doing? Like, is this the right decision? What am I doing? I don't know, I think I'm crazy, and, you know, why am I doing this? And then they gave me a shot of, like, this, like, juice, I guess, to make me feel, like, better, to calm me, and I was like, then I started just bawling my eyes out. I mean, I was just crying everywhere. I was like, it was bad, like, everyone's like, why are you crying? I was like, I don't even know. And then they had to give me a heparin shot, which I hate heparin shots, especially since it's in your belly. And but anyways, they started wheeling me back to surgery, and I had to climb on the table, and I laid down, and they were like, tilt your head back. So I tilted my head back, and they put a gas mask over me, and then that's all I remember. I woke up in recovery, and I could see my brother on the other side of the room. My brother was like, where's my sister? Where's my sister? How's my sister doing? She was upset, blah, blah, blah. So he's like totally talking and everything coming out of recovery. And I'm sitting here going, I couldn't even talk. I was in so much pain. And I was like, I had a massive migraine. And I've never had a migraine coming out of anesthesia before. But I guess this is the first time, there's always a first. So I was like hurting, and I was like trying to whisper pain to them, and then they were like, okay, she's in pain. So then they're like looking and doing all this stuff. And then in the process, I guess, of the tube and everything going down my throat, they really nicked my lip. Like, my lip was like huge on the bottom, and it had a big old cut and everything. And so they were all standing over me looking at my lip, and I'm like, I don't care about my lip. Right now, I care about pain. So eventually I got brought back into my room, which the rooms at the hospital that I stayed at, they were really great. I mean, it was like a big room, and they had 2 hospital beds, and the second hospital bed was for your guest. So, that's pretty cool. Oh, that's my mom texting me. Anyways, so, it was really hard the first day to get anything down, because like your stomach, like anytime something hits your stomach, it feels like it's dancing. Like it feels, that's how I call it. They say it's spasm, but for me it feels like my stomach is like, it's like dancing in my belly. Even the medicines really didn't control that. It really took a long time. It really took probably even like into day 4 or day 5 being at home for that to help. I still get it sometimes, but I have a tip for you. I have a tip. Stand up and get on your tippy toes and just kind of like bounce a little bit or do something like that, because I found out that if you stand and you just kind of wiggle around, it will help so much. It's unbelievable how much that helps. I cannot explain it to you. I don't know why, but it helps. I tried to walk around a lot in the hospital to get rid of the gas pain, which helped a little bit. I mean, the gas pain was really bad like the first 2 days, and then after that I really didn't have that much issues. They gave me lots of gas pills in the hospital, so I didn't really have to bring anything. Like, I brought tons of stuff, and I didn't have to bring it or use any of it. But when I got home, the Gas X strips really saved me. Like, that, I used them as much as I could. I'm trying to think. I took pain meds for the first 5 days, which was fine. I had a hard time going to the bathroom. Sorry if it's TMI. Bowel movements took a long time to come. It was probably about day 5. I had to drink like a lot of milk of magnesia. First, like day 3, I drank like a little bit. Day 4, I drank a little bit. And then they were like, no, like if you don't go, then you have to drink this other stuff or you have to go to the hospital. So they were like, take a sip of it each hour. So I took like probably half a teaspoon or half tablespoon or something. I don't even know how much I took, but I took a little bit of it like every hour. I just took a sip, and let me tell you, it sucks. It really sucks. But that night, it happened, and it's been going since. So that's great. So I don't have any worries. I don't have any complaints. Well, I have complaints. I don't like it, but at least it's better than not going. Anyways, I'm not really sure what else to say other than today I was supposed to start pudding and all that kind of stuff, but I started it yesterday because I went shopping and that stuff looked great. And let me tell you, I have been regretting this decision, regretting it, until I went to the hospital yesterday and got IVs, or day before yesterday and got an IV with fluids. I was so dehydrated, I guess from those first few days where I couldn't drink or anything. So like, I was regretting it, but now I'm feeling a lot better. I'm just trying to get all my liquids down. I'm really trying. Before I go, I wanted to say that I am a horrible protein drinker. All that Isopure I tried before was wonderful. I actually liked some of it. Now I can't even begin to taste it. Like, I try and then I gag. So I've been having a really hard time with protein, but I found this, which it got a lot of good reviews and everything, but I found this at the vitamin shop. It's the Syntrax Nectar double stuffed cookie, and let me tell you, I mixed it with lactate, and I know that lactate has sugar in it, but you know what? Right now, I need to do whatever I can do to get my proteins in, and yeah, so I got probably about 20 grams of protein in yesterday based off of this. The lactate has protein in it. I think I had some yogurt and I had some pudding, you know, and some soup. The soup that I bought had some protein. So yeah, but if you're having problems with protein, I'm telling you, this stuff, it's not a protein drink. It's not I don't taste it. I don't taste protein. I don't taste it at all. I mixed it with the milk and it tastes like I went to Sonic and got a cookies and cream blast. Like, it's really great. So, if anyone out there, I don't know if anybody's, you know, got like the same surgery date as me, the 24th, but if you do or if you're close, let me know. My brother had it on the same day. He's doing fantastic. Like, he has not had any issues. He's been great. Again, I lost 18 pounds in 7 days. I have not weighed myself since I went to the hospital and had fluids because I know that pumps you up with all kinds of stuff. So, I'll probably give it a few days before I weigh myself again. Alright, anyways, it was, I guess this is like a second part of my week 1, day 10 update. Wish that I could have come sooner, but I really felt like crap and it was bad. So, alright, bye.